Story 1. The people making the money from them and ultimately all the people those individuals convinced to vote their way because of various biases. Story 2. My mother said when I asked her why she supports the current broken system, "I don't want the government meddling with my health care." She is on Medicare. Story 3. The people it actually works for. For every horror story you hear, there are people who have perfectly fine, work-subsidized healthcare who never think of the alternative. These people do not want to try a new system because they have no problems with the current one. I am not a fan of how we do healthcare in the United States, but if you do not acknowledge the thoughts of people on the other side, you will never win. Story 4. My brother will loudly complain about his taxes increasing and how it will eventually lead to the government confiscating his firearms. Story 5. The prevailing idea among the people who support the system is that poor people are less valuable than those who have money. It is classism at its most transparent. Story 6. The issue is that approximately 60% of the working population is covered by employer-sponsored insurance, and many of those plans offer truly great coverage. It is hard to convince that majority to risk the coverage they are used to with no clear benefit to them personally. Story 7. I do not think anyone in the United States believes the system is perfect. Almost everyone can list changes they would make to fix the problem. That being the case does not mean that a single-payer system or expansion of Medicare and Medicaid is the best solution. Story 8. I believe there are a couple of major factors that continue to hold America back from adopting universal health care. The first is ignorance. Many people who already benefit from taxpayer-funded healthcare programs oppose them because they think they are entitled, but others are not. Those who pay directly for healthcare feel that this is something they have earned, and it is not fair that others may get it for free. Then you have those who just complain about their taxes increasing. All of this leads to the next problem. Politicians who claim to support universal healthcare do a seriously poor job of explaining it. Free healthcare is misleading, and anyone with common sense knows it. It will be taxpayer-funded, so everyone will be paying for it. What people do not see is that they are already paying for it because people go to emergency rooms, accumulate massive bills, and then those bills are paid by the federal government. If people had health care, they would see their doctor before the problem became so severe that they needed to go to the emergency room. A general practitioner is less expensive than an emergency room visit, so the overall burden on taxpayers decreases. In the short term, the burden will increase because all of those people who could not see a general practitioner suddenly will be able to. But in the long term, this will reduce overall spending because people's health will improve. However, we face another problem: a lack of financial regulation. Pharmaceutical companies charge too much. There is basically no contesting that. Drugs that can be produced for pennies and are sold in other nations for mere dollars somehow cost hundreds of dollars in the United States. Medical treatments work similarly. What costs $10,000 in India costs $100,000 in the United States despite using the same qualified doctors, tools, and medicines. We would need our politicians to be willing to take a stand. But why would they? Right now, they are making fortunes from your suffering. What incentive do they have to change that? This leads to our biggest problem. Every politician you vote for is corrupt. Story 9. We are a brainwashed populace. Yes, this is a broad generalization. Do not take it personally. Story 10. Shareholders. Journalism is dead in this country, all owned by billionaires who have turned healthcare into profit margin. There are articles discussing universal healthcare as if it would ruin the entire country. Solving it would just reduce the wealth of a few billionaires by a few million, but that is not very American, is it? Story 11. The insurance chief executive officer supports that. What do they care if someone loses their home and all their savings? As long as they can buy that fourth vacation house, they do not care about you. Story 12. Healthcare executives and majority shareholders love it, as do the employees working for the companies supporting the complex frameworks and adding more cost to healthcare. Story 13. Those who receive excellent healthcare from their company. Those who would pay less for the current healthcare system than for universal healthcare. Those who are self-insured for medical care and would then be forced to pay taxes for universal healthcare. Those who want to continue using their current doctors and medical services, which might not participate in Medicare for all universal healthcare. A couple of my wife's specialists would not opt into Medicare for all universal health care. They already decline Medicaid patients. Those who are worried about longer wait times, for example, being told, "You need to learn to live with that hip pain, Jane. The next available hip replacement surgery is in August 2026. This happened to a relative of mine in Europe who faced an 11-month wait. Story 14. 50% of Americans read at a 6th grade level. It is hard to inform those people about more abstract issues. Story 15. Who supports it? The same people who sell you insulin for the price of a car payment. Story 16. Civil servants who have socialized healthcare often do not feel others deserve the same benefits, in my experience. Story 17. The system itself and anyone who has not experienced a medical bill yet thinks it is fine. Story 18. A large subset of people do not like the idea of their tax dollars helping other people. Regardless, the vast majority of this subset would die without social services. Story 19. I do because I have good insurance and can get care immediately for anything I need. I would much rather that than end up waiting months to get an appointment in Canada or a similar place. Story 20. In modern America, health care should never bankrupt anyone except the most destitute, which is a tragedy but not what you wrote. With the introduction of the Affordable Care Act, the most a family of 4 should pay for medical care is around $35,000 a year. A family earning a median wage will pay much less due to subsidies. Would that $35,000 hurt a median wage family? Absolutely, but it should not bankrupt them. Story 21. The capitalists own the government and the media. They manipulate both to keep extracting profits from the working class, even though there is nothing left for them to take. They do not care if you live or die, as long as they can profit from you. Story 22. 1. Healthcare providers, because they are the ones making huge amounts of money from the system as it is. 2. People who have enough money and who see a change in the system as people being lazy and trying to take their money. They believe all people have to do is work hard and they too can have all the money they want. They have little to no concern for people who are not like themselves. Story 23. Relatively healthy people who have been frightened by the idea of someone less worthy benefiting from their tax dollars or insurance premiums are much more comfortable with the money going to people who are already extremely wealthy. Story 24. I had a long discussion with my Trump-supporting mom about this, and I think I got to the root of it. It has 2 layers. Layer 1. They think their tax dollars are paying for the health care of people who they feel do not deserve it. Reasoning differs from person to person. Mentally, the Republican Party has created countless false narratives that do not exist anywhere near the numbers they claim. People living on welfare doing nothing with their lives, drug addicts, transgender people, spur-of-the-moment or last-minute abortions, illegal immigrants, or whatever villains they can think of. The political right somehow believes these individuals are receiving free healthcare at taxpayers' expense, but also think that universal healthcare would open the floodgates to more of it. With my mom, it is specifically about abortion. She refuses to believe that most abortions are done early, and even if they were not, it is nobody's business but the mother. She does not care if it costs her more or less, even if it helps more people. Layer 2. The absolutely enormous amount of money that this broken system generates in its current state for owners of insurance companies, healthcare providers, pharmaceutical companies, and others. I even see businesses that scan websites to find a doctor or a prescription for you, engineered solutions to engineered problems. They do not want this system to change because it would mean that immensely wealthy people would become slightly less wealthy, and apparently we just cannot have that. These 2 problems together create the environment we have today and make it cyclical. What better way to halt progress than to convince voters who do not recognize its usefulness while at the same time paying politicians to keep things as they are? To change it, you would need to be someone who does not care about money, and even then, you would have to convince half the United States population that it is for the good of everyone when they are actively battered with propaganda that they are funding harmful activity. Story 25. People with untouchable generational wealth support a 2-tiered society. They are effectively royalty, and the rest are serfs. There are several wealth extraction mechanisms at work in America. Healthcare is one of the major ones. Story 26. I lost my wife of 34 years in February. Insurance and Medicare paid for most of her 3-week illness, but the hospital bill was $146,000 with no surgery. We need national health care now. The Democratic Party supports this. The Republican Party does not. Vote wisely for your children and grandchildren. So much is at stake now. Georgia voter and activist. Join Vote Forward. Story 27. I have talked to viewers of Fox News in my family. They are unquestionably the most influenced audience in the world. They live in a different reality. Story 28. Most people apparently. Many Republican-controlled states rejected Medicare expansion, and the Republican Party performed better in the last election. Story 29. The people who profit from it, and their associates in the government. Story 30. Healthcare is a massive business bureaucracy. Those who control it do not want it to change. If anyone, such as former President Barack Obama, tries to alter it, the system goes into lockdown mode and resists at every turn. Eventually, their term in office ends, the opposing party assumes control, and the system remains unchanged. Story 31. They are unkind. We had good insurance through my husband's employer. My husband was diagnosed with brain cancer at 51. In the United States, health insurance is linked to your ability to work. My husband had several surgeries on his brain. He literally could not be left alone for 2 seconds. His medical bills exceeded $500,000 in a few weeks. You do not qualify for Medicaid if you have any assets. So basically, we worked hard our entire marriage, and because he gets brain cancer, I am supposed to become homeless? Understood. Thank you. The good news is that after he died, all of our Christian friends told me to go on fake health insurance. When I asked if their own families used it, there was silence. Story 32. I advocate for a few things. Medical professionals should return to their specialties. Your local pediatrician would not be qualified to perform brain surgery. Medical professionals, formerly called medics, used to be what we call doctors today. Doctors were advanced medical professionals with doctorate degrees. Medical professionals should practice within their expertise. Health savings accounts for everyone. Disband the Department of Veterans Affairs medical system and provide all veterans with tiered TRICARE coverage. Retired pay should include full or partial premium coverage if disabled. These changes alone would significantly reduce the issue. Story 33. It is not so much that people support it. They just do not have the power to change it or know what to change it to. There is no consensus on how to tackle the problem. The Affordable Care Act back in 2009 barely passed the Senate. Did it make things better or worse? Should healthcare be managed at the national level? How do you best fund a single-payer system? How do you create incentives in a single-payer system to prevent non-productive employee bloat and improve outcome effectiveness? Why does the current system not focus on prevention instead of outcomes? It is broken. I have ideas about steps in the right direction, such as looking at Singapore, but good luck getting it changed. Until then, complaint threads will continue. Story 34. When you give something away for free, some people take more than they need. We see this even among people with high incomes, and it is part of our lizard brains trying to assure our survival. How hoarding stress balls given away at a technology event assures our survival is beyond anyone's explanation and indicates the lack of logic in those decisions. A truly free healthcare system will not work. The American healthcare system is broken on many levels, and there is no simple solution. Engaging in intellectual discussion on this is almost impossible. Also, the lobbying of healthcare companies makes true reform difficult in the short term. To some Americans, other systems are broken as well. Reports, the accuracy of which I am unsure, of impossibly long wait times for care scare many. I know in England, if you have a good job, they often provide a supplemental policy to see private doctors. That seems much like the United States system. That part confuses me. In my humble opinion, there needs to be a safety net, but also a system that incentivizes minimal use of medical care. Something like each citizen given money to spend on healthcare every year. If they do not spend it, they can keep the money provided they meet certain milestones. With preventive care, other than preventive care, there needs to be a healthy copay to see the doctor, perhaps on a sliding scale of income but still some sort of charge. Major medical expenses like cancer or traumatic accidents would be covered at or near 100%. Another consequence of social medicine is pay. Canadian nurses flock to the United States because of much higher pay. From what I understand, this is true for some doctors as well. Relatively low pay has already somewhat changed the medical community for the worse. Story 35. Many people do not know there are other options and think this is how it is everywhere. They are told this is the best option by the people who profit from it, and they accept that. Story 36. No matter what people say, Americans just won't vote for those who want to make socialized medicine a reality. Many express support and wish they didn't have to pay premiums, but when it comes to voting, Americans don't actually support it. They often do not show up to vote in primaries and then complain about corporate candidates winning. Americans also won't vote out elected officials who refuse to step down. San Francisco should be ashamed for re-electing Dianne Feinstein despite her dementia. Texas's Kay Granger was still a sitting congresswoman found in a nursing home, still collecting a paycheck. It is disappointing that people don't take the time to educate themselves about candidates and consistently vote. Many talk about how great the country is, but fail to do something as simple as filling in circles on a ballot. Story 37. People who have never had to rely on it or have not experienced financial difficulties because of it, as well as those who believe the misinformation that the wait times and higher taxes would be a greater burden than what exists in the United States. Story 38. Another part of the United States economy that was once affordable to most people, like education and housing, and the government decided, let's make this affordable for everyone. Great job. Story 39. The Make America Great Again Red Hat Group supports the United States healthcare system just the way it is. Story 40. Many people believe that capitalism is an unquestionable blessing that surpasses all else. They think companies generating massive profits is a good thing, even when those companies are clearly profiteering off the same people. Combine that with a harmful dose of bigotry, where people are willing to see themselves harmed if it means the groups they dislike are harmed even more, along with an every person for themselves mentality instead of a collective approach, and you have a formula for people accepting being exploited by the medical industry and many other industries. Story 41. American exceptionalists believe that because we are America, we must already have the best of everything, so any change must inherently make things worse. Story 42. I watched a man who follows a conservative viewpoint talk about how transgender issues and same-sex marriage should not be allowed because his Christian ethics tell him that we must do what is best for society. Shortly after, he said that no one is obligated to provide health care for anyone else. So much for doing what is best for society. Story 43. It is not that people support the healthcare system. It is that they are too addicted to the peaceful process to oppose it. Story 44. The politicians who voted against the Affordable Care Act are the same politicians receiving large bonuses from the healthcare industry. Story 45. The family of the child who died a painful death waiting in the emergency room this year would have gladly paid $20,000 less a year in taxes and paid $10,000 in health insurance to see a doctor in a reasonable amount of time. Story 46. From what I have always seen, Americans do not realize there are far better systems than the United States one. I live in Australia, which exceeds just about anywhere I have ever lived. A mix of private and public. Private healthcare is also dominated by medical professionals who determine what treatment is needed, not insurance companies. Story 47. Politicians and executives at healthcare systems and insurance companies. Story 48. The people who run such a system do not worry about bankruptcy. Story 49. The media. Healthcare advertising is a huge source of revenue. Privatizing it would cost media executives and media personalities a significant amount of money. Story 50. Mark Zuckerberg, Elon Musk, Jeff Bezos. All of these wealthy individuals use their platforms and money to support Donald Trump. Story 51. I worked for the Veterans Affairs Hospital for a number of years. The government should not be in charge of medical care. My children also have something called the Tax Equity and Fiscal Responsibility Act. It is Medicaid for children with chronic health conditions. It ensures their medical needs are fully met with private insurance paying first, but it can be difficult to manage. I have to stay on top of things. It took 8 months to get supplemental nutrition covered. It does cover chiropractic care, but chiropractors are only allowed to accept a set number of patients. It is a complicated process. Medications are not covered because it is a secondary use for the medication and not the intended use. They will not cover my daughter's antibiotics. If a mistake is made, it takes months to correct. Government-run insurance is not something I would want everyone to have. I am thankful for the help, very thankful. I will jump through whatever hoops I need to, but I would not want it to be my entire healthcare system. Story 52. I do not support this. I imagine the people who support this view things this way. Most of the bankruptcies are due to people being uninsured, that is, not working, or people who are near the end of their life. The trade-off is better medical care. Competition to enter the medical field and build better solutions is incentivized by a business where, first, the government pays for about half the costs, and second, medical care is rarely optional. Story 53. People who profit from the system and have enough influence to lobby for maintaining it as it is. Story 54. I imagine the people who have already had to pay it or go through that experience, much like those who oppose student loan forgiveness because they had to pay theirs back. Loan forgiveness should be coupled with a plan to prevent the issue in the future, just as healthcare debt forgiveness should include a plan to stop people from accumulating healthcare debt. However, the belief in equal distribution of discomfort or pain is a common mentality for many people. Story 55. Nobody is happy with the system. The disagreement comes from how to fix it. Story 56. People pay $300 per month in health insurance premiums because that is their money and they are happy to spend it on themselves. They earned that. It is better than spending $200 per month on taxes and knowing that you, your family, everyone you know, and everyone you do not know can walk into the doctor's office without going broke. Because taxes are theft. Story 57. I know many people who think socialized medical care in the United States is bad. The conversations always end the same way. They say something like, not wanting to pay for someone else's expenses. Even if I try to point out they already do, and that it would actually save us money because it is cheaper to prevent than to fix problems. It blows my mind because all of these people identify as Christian. Story 58. The brainwashed and ignorant who have been convinced that socialism is hiding around every corner. Story 59. The rich can pay to jump the line. For Christ's sake, my state is investing a lot of money into the destination medical center. My hometown has turned into medical tourism for elites from around the world. At one point, the hospital wanted to put a high-end hotel on top of the facility to keep the very wealthy clients separate from the general public. Story 60. Single payer. The hospital charges $35 for an Advil. They cannot do that when it is single payer because the single payer, the government, will tell them no, we will pay $1 for that. Just as an example. Story 61. I do not know anyone who loves the current system. There is a lot of distrust in the alternatives. Story 62. Nearly all the money in the United States health ecosystem is concentrated in privately owned insurance organizations and large pharmaceutical companies. Care providers that we interact with are often 90 days from delinquency at any given time. All the power to fix these problems relies on action from these big players, who lose money by focusing on improving patient outcomes and profit far more by pushing against patient outcomes. These organizations control the messaging and fallacies that many Americans believe. They also buy politicians to repeat their claims. It is truly just a mathematical equation. The current system costs a certain amount of money and is only accessible by a percentage of the total population, where that percentage is less than 80. Universal healthcare costs are lower and cover everyone. Somehow, the Republican Party has convinced people to pay more for less and to be hostile to the idea that paying less for more is somehow wrong. Story 63. Chief Executive Officers of United Healthcare, Cigna, Aetna, and Blue Cross Blue Shield, among others. Story 64. Don't we all support it? In my decades, we have not changed our voting strategy despite the worsening of this and everything else, so it seems we endorse it. Story 65. The insurance companies and politicians paid off by lobbyists are part of the problem. Then there are the people who have bought into the idea that universal healthcare is bad. I cannot tell you how many people like that I have encountered over the years. They argue that it takes months under socialized medicine to get an appointment or that death panels decide if you are worth spending on. I almost feel sorry for these individuals. Story 66. My parents believe it is excellent. They are fully convinced that if we had any kind of national health system, they would never be allowed to see a doctor again and would die immediately. Story 67. I do not think I have ever heard someone support the current system. People simply have different opinions on what it should be changed to. Story 68. Reddit is probably not the best place to conduct a survey on this topic. Story 69. About 38% of our population has been convinced that corporate profits are far more important than their own health and well-being. Story 70. Many people suffer from zero-sum thinking. They believe every resource is limited and that they are in competition with every other user of that resource. Anything that increases access for the masses would reduce access for them because they are already working as hard as they can for their share. This is typical conservative groupthink. They may even know that healthcare chief executive officers and insurance companies are greedy and exploit them. What they fail to see is that if the system were revised to offer better standards for healthcare workers and reduce the vast sums of poorly utilized capital going to insurance and healthcare management companies, access could be cheaper, more efficient, and more available. At this point, they usually say they don't trust the government to be an effective manager of anything because it is corrupt and inefficient. They have a point, but the government does not have to be the sole administrator. We can still leverage free market options with controls and guidance on allowable profit margins and limits on administrative overhead. Story 71. Nobody here really likes it, but many of us think the government would make it even worse. Story 72. If you attend a typical bankruptcy hearing, you will observe that there are usually two types of debtors filing for bankruptcy: those owing the Internal Revenue Service and those with large medical expenses. Many of these individuals are unfortunate people who required major medical care while unemployed. Story 73. You can get a list of names based on who voted for the last major overhaul of the healthcare system. Story 74. Pretty much anyone above the median income will pay more, but you are right. Those who have worked the hardest for what they have will be expected to pay the most. I do not see why you think this is me being ignorant. Health insurance for us is a negligible expense. The tax proposals to cover universal health care would be a significant expense for us. Story 75. Your grandparents, whose health care is 86% socialism. People with decent insurance who do not realize how much of their salary goes to their insurance. People in the echo chamber. Story 76. I do. Totally kidding. I think that it is legitimately terrible that our country can bankrupt a human being because they could not afford healthcare. I seriously do not want to live in this country anymore. Story 77. Nobody except health insurance and pharmaceutical companies. Epstein Files. Story 78. The number of cruel people in this country is pretty alarming, honestly. Then you have the folks who have been brainwashed into equating crony and cruel capitalism with godliness somehow. It is unfortunate, but millions of Americans are totally fine if medical crises bankrupt their fellow citizens. It is immoral, but when people are so convinced they are righteous in all things, this is the kind of behavior you get. Story 79. It is selfish to think, I do not want to pay for other people's costs. A belief held until one is severely affected by the system. This opinion is easy to maintain if a person is incredibly selfish or short-sighted until personally impacted. Story 80. Most surveys regarding this subject break the groups by political affiliation, specifically Democrat or Democrat-leaning versus Republican or Republican-leaning. These surveys show a high correlation between the Republican or Republican-leaning group and support for a system as described. I cannot find any good breakdowns by age, sex, religious affiliation, income level, or net worth. Story 81. Insurance companies and their shareholders profit directly from people's medical bankruptcies. Story 82. The Republican Party supports it because the alternative is communism, apparently. Story 83. You missed the big picture. It is not about who supports or does not support. There are people who absolutely do not care about anything but themselves. If there is a way to make money on something that is legal, they do not care how it gets into their hands. Of course, there are those who do not care if it is legal or not, and with enough money and power, they can even make illegal things legal, but only for themselves. Story 84. Dishonest insurance companies and unethical Republican politicians. Story 85. Apparently, the United States Congress does. They have had decades to work on it, but it does not get any better. Story 86. Who, if anyone, in the United States supports a system where a lot of money goes to the people who provide or control the resources or service, even if it harms average citizens? Pretty much everyone who makes money from it. The landlord is not lowering my rent. The heating, ventilation, and air conditioning technician does not care if installing the new furnace I need means I might go without food for a while. The contractor who installs new windows does not care if I cannot go on vacation for 2 to 3 years to pay for them. Story 87. Republicans and establishment Democrats receive money from it. Story 88. Not entirely true. If you are healthy enough to work and are not sick or in the hospital, then you have the opportunity to pay a lot for coverage and services you mostly will not use. However, once you get sick and cannot work, there is a limited amount of time before you are essentially on your own. Story 89. The politicians are receiving kickbacks from pharmaceutical companies, medical providers, and supply companies. Story 90. Many people would rather be bankrupt than have a single dollar of their money go to others for help, especially to the wrong type of people they do not like. Story 91. People who are brainwashed into thinking that if everyone has coverage, the overall access to and quality of care will get worse for them. Story 92. Politicians supported the healthcare industry because it is a good source of political contributions. Regular citizens have been programmed to think of any other form of system as communism, but not the one in Scandinavia, rather the Marxist-Leninist, Stalinist, Maoist, Ho Chi Minhist one. I worked with people in 2009 who hated the public options because their healthcare would have been decided by government death panels, instead of some person hired by United Healthcare to deny all requests in the hope that applicants would die before their appeals could be reviewed. It is brainwashing and propaganda at a level not many people outside the United States have experienced. Story 93. The people who make money off this system are obviously not the ones being taken advantage of by it. Story 94. Honest question. Where are we going to get doctors from when healthcare is free? Even if this new system pays for undergraduate and medical school, someone still has to dedicate a decade or more of their life to acquiring the skills required to provide this care. Since it seems very unlikely that they will be making the $300,000 to $400,000 doctor's salary providing care paid for by the government, who is going to make that commitment? It seems to me that the insurance industry is really what is driving up the cost of care. Premiums are always going up and reimbursements to providers are always going down. Someone decided it was a good idea to put a for-profit company between patients and doctors. Insurance is supposed to transfer risk from you to them for a fee. That transfer does not occur if you lose your insurance when you need it most. Story 95. The people running the system. The purpose of a healthcare system should be to provide healthcare, and if you have to pay money to accomplish it, that is the price of doing business. The purpose of this healthcare system is not to provide healthcare. The purpose is to funnel your money to them, and if they have to occasionally provide healthcare, that is the price of doing business. Story 96. Those that support it can be put into a few categories. The owners and executives who made their fortunes on the system. The shareholders who also make their fortunes on the system. People who have been convinced that anything else is socialism or communism by the very people who make their fortunes on the system. Story 97. Some people are angered by a system that requires them to contribute to helping others. They would rather pay more to avoid assisting those less fortunate. Our individual-first society is flawed. Story 98. You might go broke, but there are no long wait times, the quality of care is higher, and there is choice and competition. As a whole, we have better doctors, hospitals, and research. Story 99. The entire health insurance industry and all of the politicians they have purchased to do their bidding. Story 100. I just don't feel better until the hospital performs a colonoscopy. Story 101. The people who make a lot of money from it, who in turn pay politicians to ensure no alternative is allowed. They have convinced people that universal health care is an evil form of socialism and communism. while ignoring all the decidedly capitalist nations where it works fine. It turns out having a healthy populace is quite good for capitalism, actually. Story 102. No one wants to see people divided and bankrupt due to health issues, but maintaining the system as it is means profit for companies and loss for citizens. The question is this a free choice or disguised corruption? Story 103. Free medical care in Europe is bankrupting entire countries. Story 104. Trump voters. If you want an approximate number of people who desire this, it is probably reasonably accurate. While these individuals may not admit to wanting this type of system, they would openly admit to voting against sensible alternatives, as they would struggle to distinguish between them. Story 105. I've certainly met a lot of people who think the United States system is great. Many of them have direct, first-hand experience of how it is far from great. While I've had limited success changing minds about a few highly contentious topics over the years, I've never once managed to convince anyone who thinks the United States system is great that it is actually awful. What absolutely frustrates me about this is that even without direct, first-hand experience, even the most basic understanding of the system should illustrate the inherent problems with the concept. For example, insurance seeks to make money, and as a rule of thumb, an insurance company tries to pay out no more than 90 cents on every dollar they collect. Built right into it is that your money is 10% less effective. They implement complex regulations regarding how payments and billings work, requiring entire professions just to navigate those. This means that at every medical institution of note, there are people whose only function is to figure out how to get the insurance that you pay for to cover your care. Now the cost of your care has gone up. The medical professionals have their own requirements, meaning that they cannot see as many patients, meaning that they need more of them, and so again the costs go up. They set prices without regard to what something costs, put hurdles between you and care, frequently leading to worsening health and even death on a regular basis, and so your care is worse because they are involved. There is literally no advantage whatsoever to anyone but their shareholders and, distantly, to their own employees. And yet, despite this, somehow what is obvious at a glance has never convinced someone that our system makes everyone less healthy and frequently kills them for profit. It is everyone's worst fears about single-payer systems happening all the time and on purpose, and yet somehow their system is great. Story 106. I'm genuinely conflicted on this argument. The United States has the best healthcare in the world for a reason, but that reason is problematic. I do not think the $10 per cough drop situation is acceptable, but at the same time, the reason the United States is the leader in almost all aspects of the medical field is because it is highly lucrative and human nature is greedy. It is like a monkey's paw deal. You will have the best medical care in history, but it will be impossible to reasonably afford. Story 107. The for-profit healthcare system and private equity seem to like it. Story 108. Liberals and conservatives, leftists and progressives oppose it. The 2020 presidential primaries were eye-opening in that regard. Story 109. There are many people in the United States, usually religious, who want to believe the world is at least somewhat fair and that all health ailments are avoidable with diet and other lifestyle choices. They view the need for healthcare as a personal failure until they themselves require medical care, at which point it becomes a necessity. It is unclear whether this attitude stems from Christianity, conservative social media, or both, but recently I have heard many say that certain individuals would not need chemotherapy if they just ate properly and stopped relying on doctors. This is very frustrating. I understand that some people cannot accept that the human body can sometimes fail, but it is upsetting to see cancer patients being blamed for their illness. Story 110. Many people are misinformed about how our system currently works and what alternative models look like because of aggressive capitalist propaganda. Story 111. Sometimes you need to ask for help or do research. Story 112. I had a coworker who did not support single-payer or government-run healthcare because her fear was that whichever party was in control could arbitrarily change rules, access, policies, and so on. Based on what the current administration has done with other things, this is a pretty valid concern. So for her, the status quo and private insurance were preferable. Story 113. Corporations are legally recognized as individuals who are highly interested in maintaining the status quo. Story 114. I do. People are responsible for their own lives. They should not demand that others take care of them. Story 115. Honestly, some of it is directly linked to the not on my dime mentality, coupled with a strong desire to avoid paying any form of taxes, regardless of what those taxes fund. Add in the for-profit insurance industry, their lobbyists, boards, and shareholders, and you have a recipe for sacrificing human life for profit. Some people go along with it because they would rather go broke than share the burden. Story 116. Healthcare comprises roughly 14% of the entire American workforce. It varies over time, but that is approximately 17 to 22 million people. The lower levels of those workers often dislike the cost of healthcare, but the higher up the ladder you go, the more money you make. And the less likely you are to be burdened or worried about the cost of healthcare. People at the top absolutely do not want to see a decline in the rising cost of being unhealthy. I estimate that around 8 to 12 million healthcare workers are comfortable with the price of healthcare. This is not to mention all the subsidiaries such as equipment sales, accounting and billing services, ambulance providers, pharmaceutical companies, and others. There is massive monetary gain in healthcare for a substantial number of people. Story 117. Tons of people do, and it is because they think the other option is a socialist system that will deny them healthcare. Fundamentally, Americans do not understand or will not admit how these systems work. They are convinced that you are constantly on waiting lists for vital services. For far too many people, it is better the devil you know than the devil you do not. Story 118. Republicans and individuals who believe they will never have to pay those costs. Story 119. No one receives free health care. You can pay through taxes or insurance. People with little or no money in the United States tend to get inexpensive insurance or free care. Are both systems flawed? Yes. Do I support universal health care in the United States? Yes. Story 120. Those are probably the people who are rude to service workers. Story 121. Health insurance providers and their lobbyists. Wealthy individuals. People who own stock in health insurance providers. Story 122. I know of one person who did, but he died last year. There are probably others though. Story 123. Besides those making money from it, those who are either A, ignorant, or B, have insurance. You have to remember the current system works for those who have insurance. The issue with this mindset is that you are in trouble if you lose your job, but most do not see past this because they are so worried about people taking advantage. Story 124. It feels like nobody truly supports it, only those profiting. Do you think most people are too overwhelmed to fight for change? Story 125. Right now, our monthly health insurance premium is more than our mortgage payment. My husband is self-employed. Yesterday, I read an article about losing the subsidy we receive next year, and the premium is expected to increase by 5 to 20%. I honestly do not know what we are going to do. Story 126. Because most members of the Republican Party do not think it can happen to them. Story 127. We know that lawsuits add significantly to healthcare costs in the United States. I would like the option to sign away my right to sue the doctor or hospital. I would choose this option to save the costs that the risk of lawsuits adds to every procedure and hospital stay. I would choose providers with a proven track record and accept the risk that something unintentional could go wrong. Story 128. There is a long list of intermediaries who profit from this, including lawyers, billing services, and debt servicing. Story 129. They voted for it. I wish Canadians would stop comparing ourselves to the United States. It's apples and oranges. Story 130. Yes, it can do that. But you will not go bankrupt going to see your doctor, having your checkups, or anything non-serious. I prefer that over sitting in a queue for an indefinite period for specialized care, having treatment measured against the federal budgeted allotments, or unionized nurses. Story 131. They do not have to defend the current system if they can convince people that the alternative is even worse. Story 132. I know a few people who are happy with the system, and I think I understand why. These are people who have corporate or government-paid healthcare plans. They do not see or understand how much money they are paying for healthcare and do not consider how a layoff can lead to financial ruin. Since they have a good job that subsidizes their healthcare, They are content with the system. Ironically, the people I know who are vocally supportive of the healthcare system work for the government. Retired government employees and veterans have subsidized access to healthcare for life. They enjoy the closest experience to socialized healthcare in the United States. They have taxpayer-funded, top-tier healthcare. They are unaware of the challenges other people face. Story 133. People who have been brainwashed with fear by people who are making billions off the broken system. Please wake up. Reach out and talk to your Canadian friends. It is not perfect, but it is much better for their citizens. Outcomes are better too. Story 134. Nobody cares until it happens to them. Empathy is not the default human behavior. Story 135. I support Americans having that system. It ensures that the rest of the civilized world has a real-world live example of what happens when privatization is left unchecked, so our populations maintain a strong desire to keep free at point-of-access healthcare systems. Keeps our politicians in line and privatization at bay. Nothing's perfect, but having been born and raised in the United Kingdom, having lived in Australia, New Zealand, Germany, Hong Kong, the United States, and now Canada, I can safely say that I prefer free at point-of-access service. Story 136. Well, it is their fault they decided to get cancer or have a car hit them. I would rather pay higher taxes for hospitals to provide emergency care to people without insurance and pay high monthly premiums for care, which I have the privilege to pay a minimum of $35 every time I want to use it. It is even worse if my doctor charges me hundreds of dollars more a month just so they can bill my insurance, only for the insurance company to review and decide they will not cover a procedure. Story 137. Health insurance companies and large pharmaceutical companies support it strongly. Story 138. The problem is that our government has repeatedly shown it cannot run an efficient competitive system. The corruption in the government could extend to this new area and make things worse. Story 139. A lot of people do. I know Reddit makes it seem like everyone here is drowning in medical debt, but that is simply not true. Story 140. Undereducated and heavily misinformed people who are afraid of change. That is a lot of people. Story 141. It is a well-designed plan from their perspective. If individuals cannot pay, sue them, take them to court, and garnish money from their paycheck. If they refuse or are unable to pay, once they become homeless, place them in private prisons that are compensated based on the number of inmates they house. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.